Your airway is not supposed to make noise while you're sleeping. So not everybody snores, but if there's any audible sound to someone who's sleeping, typically means you have airway obstruction and airway restriction. Feeling tired in the morning, being cranky, the people that tell you don't talk to me till I've had my coffee, all those are because you're not doing the work of sleep while you're sleeping. You can be in light sleep the entire night and wake up after 10, 12 hours and be exhausted. Because unless you're getting into the deep restorative stages of sleep, it doesn't matter how long you're in light sleep, you're gonna wake up tired. There are two hormones, leptin and ghrelin. One hormone makes you feel satisfied and full. One hormone makes you feel hungry and wanna start eating. They get reversed. And when you've had poor sleep, it makes you want to eat more, and it's harder to fill those cravings, so you keep eating and you keep eating. So sleep very directly affects how you eat and what you eat. I know a lot of these high-level CEOs that run huge companies, a lot of these guys feel that way, that I'll sleep when I'm dead, but quite honestly, it is the worst possible attitude about your health and about your life, because your body can only undo the damage you've done to it during the day while you're sleeping. You do not go through any repair while you're awake. So you have to get into these deep restorative stages of sleep so that you can stay healthy. Some of the things that we notice when we look at a person, one of the first things that I see is a vaulted palate. The palate is the floor of the nose, so it's gonna invade the nasal cavity, it's gonna invade the nasal space, and it can actually scrunch up the septum and cause deviation of the septum because the maxilla, the upper arch, didn't expand properly. Another telltale sign that somebody may have a sleep issue is the tongue. The tongue is one of the primary things that invades the airway, right? So when you fall asleep, you have muscle relaxations. Your muscles get nice and loose, including the tongue. So an enlarged tongue is a very telltale sign. We typically see this more in women, but a scalloped tongue. So when somebody opens their mouth and you look at the tongue and it looks like ribbons on the side, it's scalloped. It's because every time there's airway obstruction, the tongue gets activated and gets thrust into the teeth. When there's an arousal to the brain, so when there's airway obstruction, there's a little signal that gets sent to the brain saying, hey, I'm not getting air, wake up. Every time there's this little micro arousal to the brain, the muscles activate, including your chewing muscles. So waking up with a sore jaw, waking up with muscle tension in your temples, on the side of your jaw, are all because these muscles are working hard while you're sleeping, while they're supposed to be resting. If you wake up with pain in the morning, that is a clear sign that your body was not doing what it was supposed to while you were sleeping. Part of the sleep restoration program is replacing the missing elements of life, one of which is vitamin D. Vitamin D is literally an over-the-counter hormone that you can buy at the store. The reason vitamin D got called vitamin D is because it got discovered after vitamin C. It is made from cholesterol. When UVB radiation hits your skin, there's a single bond broken in a ring on cholesterol, and now it is vitamin D. There's a vitamin D receptor on every single cell in your body. It's allowing your body to access your genes to make the proteins, to make the enzymes, to do what it needs to do. Without sunshine, without vitamin D, your body is going to be limited in what genes it can access. Vitamin D deficiency is not because you're not eating the right things. Vitamin D deficiency is environmental. It's because we were hunter-gatherers, we lived outdoors, we now live indoors, and most of us slather ourselves in sunblock, sunscreen when we go outside, especially children, which definitely causes a huge problem. By the time you get to be an adult, a lot of damage has happened. Vitamin D can definitely help improve the quality of your sleep. With children, it's very fascinating. You can have a child that snores and grinds their teeth, and you give them vitamin D, and like magic, it just disappears. One of the things that I really enjoy doing is when I'm doing a procedure, I often have a couple of hours with the patient and trying to educate my patients so that they can have an overall better quality of life. I mean, that's just something any good, conscientious person should do. If there's somebody in front of you and you have information that you think would help them, of course you're going to want to share that with your patients and with your friends and family. Vitamin D is very important. If you think back 20, 30,000 years ago, how we lived, during the winter, food was scarce. If you had a baby born in November or December, when it was freezing and no food around, you could see how that would significantly impact the development of the child and their ability to survive. Vitamin D regulated fertility to make sure that the baby is born during the right time of year. So vitamin D deficiency is one of the things that's linked to infertility. I have 2 children myself, and I did a home experiment with them. Not on purpose. When my first child was born, I didn't know about vitamin D. My daughter was born, she was 7 months old. She was grinding her teeth fairly bad, and I could hear it across the room. She wasn't really sleeping through the night. She would wake up quite a bit. My son, on the other hand, I knew about vitamin D, and I supplemented him from the time that my wife was pregnant. So he always had proper levels of vitamin D. I definitely see some differences in my children, their development, as far as their sleep, their health. I definitely see a difference in the development of their arches. My daughter does not have crowding. However, I do have to floss her. She has contacts, her teeth are touching. She doesn't have any crowding, however. My son has a much broader arch. His upper arch is more U-shaped, and he has very large spaces. He has a lot of room for the adult teeth to come in, because that's one of the things people have to understand. The adult teeth are much larger than the baby teeth. So when the baby teeth fall out and the adult teeth come in, there has to be growth. There has to be expansion of the jaw. Otherwise, it's going to result in crowding. Vitamin D, I really feel, has affected how my 2 kids have developed. Vitamin D is a hormone. It has many functions, including directly acting on your genes and your DNA. Vitamin D stabilizes DNA gyrase. So basically, when a cell is copied, the double helix is unwound and new cells are made. Vitamin D plays a role in the unwinding of the DNA so that it can be properly copied. So vitamin D deficiency can literally affect gene expression and how this information is copied and what your body has access to. The reason vitamin D got called vitamin D is because it got discovered after vitamin C. Vitamin D is literally an over-the-counter hormone that you can buy at the store. It is made from cholesterol. When UVB radiation hits your skin, there's a single bond broken in a ring on cholesterol, and now it is vitamin D. There's a vitamin D receptor on every single cell in your body, which is why vitamin D deficiency can have so much effect on your health. It's allowing your body to access your genes to make the proteins, to make the enzymes, to do what it needs to do. Without sunshine, without vitamin D, your body is going to be limited in what genes it can access. Vitamin D3 and K2 go hand in hand. We used to get vitamin K2 from our diet. It comes from grass-fed animals. When cows graze in the pasture, their products are high in K2. Milk, cheese, meat. Unfortunately, due to modern farming, it has changed. It's difficult to get vitamin K2 from a good diet, even if you eat organic. The way that it plays a role, calcium is one of the key things that regulates how your body functions. Not only is it responsible for support and bone, it's responsible for function. If you're missing D3, you are not going to absorb the calcium. If you have D3, but missing the K2, it can actually harden your arteries and cause atherosclerosis because you're absorbing all this calcium, but you're missing the K2 to take it out of your bloodstream and deposit it into the bone. It's known that vitamin D and calcium go together. What is little known or less known is that K2 is just as important. Vitamin D3 allows you to absorb calcium from your food, from your gut. So now it's circulating around in your bloodstream. Well, the function your bones serve is to store calcium. When you have an excess level of calcium in your bloodstream, your body takes the calcium out of the bloodstream and deposits it into the bone. When you need calcium, your body breaks the bone down. So they go together. Both are needed for your body to properly metabolize and properly use calcium.